This meeting is now being recorded. All guests have been unmuted.
It's not, no. Tomorrow, they're coming.
Okay, can you hear me now?
Yes.
Oh, sorry about that. We're going to start all over again. I'm going to go ahead and mute you guys.
All guests have been muted.
Okay. I hear breathing. Sorry about that. So, as I was saying, please be on the lookout for a survey. All CCBs will be sent a survey, and we'd like that just one person per CCB fill it out. And we're collecting information about who is currently conducting assessments for children in your program with established conditions, as well as who is doing the hearing and vision screening, and if you're having any difficulties with conducting those assessments and having access to OAE machines and things of that nature. So please take the time to complete it as soon as you receive it so we can start collecting that. The other update we have is that Health First Colorado is going to have a new web portal. So Beth is going to talk about that.
So for about a year now, they've been in the process of switching over from Xerox, managing all of their PARs and billing, to HP. HP has been handling all of the prior authorizations for the last year. And as of October 31st, it's supposed to switch over to HP, also handling all of the billing. Right now, providers are supposed to be doing training, but I've heard from a few providers that that's been a bit problematic. They're having trouble getting into the training. And so direction came out today from Medicaid that they're going to continue to accept paper billing submissions for the time being, and I think that will help with the crossover between the two systems until everything gets up and running. But you might hear some comments from your providers about this issue and concern that they're not going to be able to bill come October 31st. But just know that I'm working with them and I'm working with Medicaid to try and make sure that everything happens the way it's supposed to. So going on to the telehealth training, we have now recruited a family to do the filming for the telehealth modules, actually several families. And so we have family in Dacono and a family in Fort Collins and a family in Westminster. And I think we have a family in Pueblo who are going to actually have some actual filming for the telehealth training. So we're really excited about that. There's going to be a total of 4 modules, and we're hoping that the modules will be available online for providers to start taking by December. There's a question about CCBs being made aware of the families that are participating. We haven't really discussed that, but we probably can let the CCBs know if it's one of your families who are participating. I think one of the families in Fort Collins might not actually be an early intervention, but it's a child who is in the birth to 3 range who is receiving services from an EI provider via telehealth. And they were chosen because we looked at the families that the providers who are actually utilizing telehealth, which there aren't too many right now. We talked to them and they recruited families that they thought would be good to film. So that's how they were chosen. Crystal, you still can't hear anything?
I mean, she wouldn't be able to hear that.
Well,
Go ahead,
okay, so I think others can hear me. So the telehealth training will be free to providers, and we strongly recommend that service coordinators and EI coordinators, directors also take the training because it'll help you all understand some of the nuances, as well as the training is going to have a lot of video examples, and so I think that'll be good for service coordinators and EI directors to see those examples so that you have a better understanding of what telehealth really looks like. So moving on to the EI certificate, this training is also moving along, and the last 2 weeks I sent out an email to providers in the EI data system asking for volunteers to pilot the training, and I was floored when we got almost 70 providers who said that they were interested in being part of the pilot. We only had funding to accept about 20 providers for the pilot, and so I really tried to balance out geographic location, discipline, experience level, and so I sent out the list of the 20 providers who will be doing the pilot to all of the CCBs so that you could see who it is that's going to be piloting it. There will be a total of 7 modules. They'll be all online, and the total amount of time for the training will be about 30 hours. We're anticipating that the pilot will begin when the first couple of modules are available, and I think we're looking at probably December. And then the people who are piloting will pilot all 7 modules. Once it's finalized, the training will be free to all providers. We are looking into seeing how we might be able to offer CEUs for this training, because that's really important for providers. And then we're looking at the full training being available to all providers by the middle of next year. And then we're hoping to have a community of practice monthly call to support providers who have gone through the training, figure out how better to actually put the ideas and the information learned in the training into practice. At this point, the EI certificate training will not be a requirement. We are aware that it is a requirement in other states, and it is under discussion, but at this point we are not requiring it.
Okay, thank you, Beth. Okay, hopefully we have our audio issues ironed out. If you're still having difficulty hearing us, you may want to sign off and sign back in. I think it resolved on our end here. So we wanted to give you an update about what's happening with the Global Outcomes for Infants and Toddlers, or Go For It. And right now, the first cohort, cohort 1, is in the process of evaluation and assessment using the Quality IFSP self-assessment tool. We're calling it the QIO right now. And we're looking at team leads for Go For It, evaluating IFSPs, and we are verifying them at the state to make sure that we're both filling out the tool to fidelity, and we're making adjustments to the tool based on some feedback and some observations that the General Supervision and Data Unit has had and the Program Initiatives Unit. So we're really excited about the use of this tool, and we're not yet at the point where it's going to be available for service coordinators to do self-assessment independently. We believe that that is a ways down the road yet while we offer more training and technical assistance. The second cohort, our current cohort this year, all 5, actually it's 7 communities, excuse the typo there, have participated in the community mapping and action planning process. And actually 2 of the 7 communities have been trained with the universal training and will begin their early implementation activities. The rest of the communities will complete their training by the beginning of February. And that's another typo. I am so sorry. That's 2007, see. So it's been a week around here. So I apologize for these typos. I don't know how I missed them. So we're excited with all the work that we're doing. We are out in the communities, Wayla and Laura and I, madly training, madly traveling, and are excited about the work that is occurring with Go For It right now. Oops. So community center boards that have not yet been a part of the Go For It initiative, I just want to put it out there that it's really not too early to begin preparing for the integration of the IFSP and the Child Outcome Summary process. And ways that you can prepare is to discuss Go For It with leadership in your CCB, so your executive directors, your CFOs, your community partners, Child Find, your early childhood councils, and really share your CCB's intention to integrate in the upcoming year, because the remaining CCBs will get this underway next year in 2017 and wrap up in 2018. And also you can start thinking about what processes you might need to change or adjust now to prepare for Go For It. So that might be thinking about who will take the lead in integrating these changes in your organization. Is that going to be the EI director? Is it going to be a lead service coordinator? Who really has the time to take this on? Thinking about any staffing issues you have, because it's going to be really helpful to be fully staffed as much as you can be when undertaking this work. Is everyone currently doing family assessment? Is everyone trained in the child outcome summary rating process? How informed are your providers? What will they need to know in order to be strong partners in this process? So really thinking that through now is going to help you for next year. Okay, I'm going to pause and unmute for any questions you've had to this point, hopefully.
All guests have been unmuted. All guests have been unmuted.
Having some laptop issues.
All guests have been unmuted. All guests have been unmuted. All guests have been unmuted.
You guys unmuted? Sorry, we're having technical difficulties today. Good day to be in bed. Any questions thus far? Okay, I'm afraid to remute everybody, but I'm going to try. Right.
All guests have been muted.
Okay, Ashley?
All right. Hey, everybody. It's Ashley Ness here, and I have a couple updates for the unicorn that were rolled out last Monday. If you participated in Monday's webinar, the unicorn webinar, this might be a little bit of a review for you guys. Otherwise, if you did not, this is all new information, so great. So last Monday, the 26th, we had our enhancements roll out. We have the offline IFSP that is available for initial IFSPs. That's available now. The EI service type on the EI services and agreement tab, that is now a requirement. Users can choose to include the transition tab to print out on the complete IFSP. So be aware that I believe it defaults to being unchecked. So if you go and print an IFSP and you notice that the transition page is missing, just double check to make sure that you have it checked to include on the print. Users will now be able to archive IFSPs. So this is only for when we did not go backwards and archive IFSPs that were already closed. So if you are closing IFSPs as of September 26th and forward, the IFSP is going to be archived. If users are seeing something different, please let me know, because that was not the intent. So that is now happening, and the archival of IFSPs is freezing that IFSP to give us a point in time information and to have data integrity. The actual start date of services is required. So this is a new validation rule that we put on. So I know last month there was some issues when it came to billing. A lot of services, a lot of activities did not get pulled, and there was a lot of error messages. We lifted that trigger last week, but it is now back on. So you will not have the same issues that users ran into this last month when it came to billing. The system will start catching it as soon as users are working in client cases. And the actual start date, that cannot be a future date. We also have our indicator reports that are available. So indicator 1, we have 2 separate reports that users can go ahead and look at. The first one is called the late services and the number 1. This report includes all services that are missing a start date and or late reason, as well as all services that have been recorded as late. We included that type in there so users could have an idea of what they're going to be reporting out for the year-end data, and then also if they want to go back and double check to make sure if a service wasn't late, they can go ahead and correct that. The other report that's available for indicator 1 is the missing start date of services. So this is more specific to children that have had an IFSP meeting after 9/15/2015. So that was our go live date of the system. We have 2 separate reports for all indicators, not just indicator 1. The idea behind that is to give users a different feel of the reports, and so that they can go ahead and look with what is going to work for them when cleaning up the data. So let's see here. Jean, you have had some issues closing an old IFSP that a transition late reason was prior to even kids who left prior to transition needing to be done. The only option, yep. So if you're closing out an IFSP that does not have a transition, and if a parent, if a transition was not needed, we do need to clean that up a little bit with our developers, but that is, if a transition conference didn't happen, go ahead and put in parent declined, and they are taken out at the end. So indicator 7, so this is timely IFSPs. So the 2 reports are children without IFSPs. So this includes missing IFSPs, this includes missing IFSP meetings and late IFSP meeting status of closed eligible. So if a child is closed eligible, we would expect that there would be an IFSP. So if users are looking at that report and seeing closed eligible, and there wasn't an IFSP meeting, they may need to go back and adjust the close reason to close not enrolled, okay? We'll talk about that status in just a moment here. And the other report that is available for indicator 7 is called indicator 7 with percentages, and this includes IFSP meetings and or reasons late, as well as all late IFSPs. So this is, again, to give users an idea of what they're going to be reporting out in regards to late IFSPs. Okay, so we have the status of closed eligible versus closed not enrolled. So if a user is choosing closed eligible as an exit status, that is for a child that was active, had a complete IFSP, eligibility was determined, and outcomes were developed. So if a user chooses closed eligible, then we would expect to see an exit reason. If users are choosing closed not enrolled, this is specific for a child that was never active or only had an evaluation and was determined not eligible. So if you have a closed not enrolled, we wouldn't anticipate to see an IFSP meeting, transition conference, any of those information for that one specific. If you choose closed not enrolled, a closed not enrolled reason is needed. So down below there we have 2 new statuses that we are working on. We're going to start to implement. We're going to change the names around. So from closed eligible, it's now going to read closed IFSP, and an exit reason will be needed still. And then for closed not enrolled, we're going to change that to closed no IFSP, and a closed no IFSP reason will be needed. We are looking into making this adjustment more towards the beginning of the year, so just be aware that this is coming. For children that were not eligible, do we still need to complete the eligibility page on the IFSP to show why? Yes. Good question. Okay, for indicator 8, we have a couple different options. So there's an audit report for indicators 8A, 8B, and 8C. So there's actually 3 separate audit reports right there, and that is for children that are missing information as well as all late. There is also a list view. So this is kind of giving giving users a different option. The list view is available on the Client Case tab, and it is called Indicators 8A, 8B, and 8C. So it has all of the information that is missing. If you have a child that is missing a transition conference, but there is a plan in there and an LEA notification date, that child will still be pulling into that list view. With all of the reports that are available, you might notice that some fields are missing or some fields are not helpful or need to be adjusted or tweaked. If that is the case, please let me know, and I'm more than happy to make those adjustments and add fields. So year-end data is due November 1st. So keep cleaning up all of that data. All the reports that are available for all users. And I sent out an email yesterday to everybody as well as posted in the chatter that there is an additional July indicator 8C. So this is for children that are missing either a transition conference date and or a reason for why it's late. Please take a look at that. It is due October 12th, so that is next Wednesday. All of the July data should have been entered by August, so please get in there and enter this data as soon as possible. All of the reports that I just went over, this is all located in the Early Intervention CCB folder. All the reports are available in the Early Intervention CCB folder, so all users can go in and look at those. And information, again, is due next Wednesday for the July Indicator 8C. I also just want to kind of let you guys know that these might seem like they are very tight timelines. However, these are year-end data. This has been pushed back a month. And this is information that we have to report out federally every year. And this is also information that we are reporting out monthly to executive management. So if you're getting multiple emails from me or calls, please just enter the information as soon as you get it. This is in regards to CAPTA referrals, any sort of service start dates, and transition data. Very important for my job that this information is entered correctly.
Thank you, Ashley. Okay, and finally, we just want to wrap up with some upcoming dates and reminders. Just a reminder that next Monday, our office is closed for the Columbus Day holiday. There are 2 upcoming office hours for bridge training. So if you have new service coordinators that are participating in this training, WALA will be available on October 18th and November 1st. The Go For It Community of Practice call for both cohorts is scheduled for October 20th. We have our next ICC quarterly meeting at Imagine on November 2nd, and that's open to everyone. And we will have our next TA call on November 3rd, and our offices will again be closed November 11th. Okay, I'm going to unmute everyone in case we have any final questions for today's call.
All guests have been unmuted.
This is Sarah from Mountain Valley. I just wanted to clarify for kids who go through an evaluation but don't qualify for services and we mark them as closed, not enrolled, we still need to create an IFSP with that eligibility information?
Yes. Yes.
Okay.
Yes. As it relates to the closed eligible, that's what we would expect that you have a complete IFSP. So for those that you only have the evaluation, it would just be that eligibility information.
Thank you.
Do all reports need to be updated by November 1st? Yes, all of the indicator data, that is part of our year-end cleanup. That is due November 1st.
I get that giving folks an extra month, basically, right?
Yes. And I will say, if people need assistance with the reports, either understanding them, how to locate them, where information is needed, please give me a call or either email me. More than happy to help out. I know this information is very important to everybody, so I'm more than happy to help.
Okay, any other questions before we wrap up today's call?
Hey, this is Penny. I have a question about the IFSP archive. When they put that close date in, let's say like 9/28 is closed, does that IFSP automatically right then go into an archive state?
Yes.
Okay, so in October when we're doing September's billing, and let's say on the 28th that child had their last service provided, OT, PT, whatever. If on 9/28 that's closed and archived, how are we going to bill in October against that 9/28 date? And
you can still the archival of the IFSP isn't going to negatively impact the utilizations or activities.
Okay.
It's just information that's specific to that IFSP that is entered at that moment. It just freezes it.
Okay. So it shouldn't affect the billing.
Absolutely
that
not.
should all look normal to me.
Correct.
Got it.
Correct.
Okay.
You should not be impacted by that.
Okay. That was it for me.
Great question.
This is Tracy.
Thanks, Joe.
I have one request, and that is that you guys try to make sure that service coordinator contact information is in the data system, if at all possible. Because I sometimes get families calling to reschedule their evaluation, or providers calling wanting update. And if I can access that service coordinator's information, then I can give them that information instead of having to track you down. Can you help me? That kind of thing. So that would be really helpful.
Great. Other questions? Okay, well, thank you for joining us on this rainy Thursday. The slides are currently posted on the EI Colorado website right now under the training tab. And if you go to monthly TA calls, it should be there under today's date. So the slides are available right now. And we will post the recording. Again, we apologize for the technical difficulties. If we have an opportunity, we may re-record it. Thanks. Have a good day.
You too.